Good morning, everyone. Welcome to this morning's episode of Tooth Teacher Tuesday. Dr. Z here, and we're rolling into the new year. Winter freeze has hit the Indianapolis area as well as a lot of the country. But as this new year continues to roll on, people still are probably sticking with their New Year's resolutions, a lot of those related to improving their health. And so again, kind of along that same line of thinking, wanted to talk today about how your dental health affects your overall health. It's often said that the body is connected. Every part affects every other part, and that's not just a cliche. It's very much true, even though you might not think that your mouth would affect your kidneys, for example. It's all connected. So, like I said, talking about how oral health affects overall health. Without going into detailed medical explanations for how these are related, essentially, our bodies are full of bacteria, both good and bad, and all bacteria, good or bad, release byproducts as they go about their normal life cycle. Some bacteria are good. You think of the bacteria that help regulate your gut. That's why a lot of people take probiotics for their gut health. But a lot of bacteria in your mouth are bad bacteria. And there's a multitude of different types of bacteria in the mouth. Some cause cavities, some cause periodontal disease, affecting the gums and the bone around your teeth. And the way that these bacteria can impact your overall health, even though they may be contained just in your mouth, as these bacteria go about their regular life cycle, the byproducts they release are toxins. And these toxins, when they get into your body, if you're not properly brushing and flossing and maintaining overall good oral hygiene to reduce your bacterial load, enough of these toxins can get into your body and can cause inflammation. And inflammation is the enemy of us all. And that inflammation caused by these oral bacteria can contribute to, not to say that they're the sole cause for different health conditions, but they can contribute to or worsen various health conditions, most notably cardiovascular disease, particularly blood pressure. Diabetes is especially notorious, that oral health, if it's poor, can worsen your blood sugar, worsen your diabetes. And there's even newer research that is linking oral bacteria to contributing to disorders of the nervous system, including Alzheimer's disease, which is a big deal in modern medicine, trying to find a way to combat Alzheimer's disease. And so these are just a few health conditions, but it gives you an example of how, while you wouldn't think that your blood pressure would be related to how well you brush and floss your teeth, there is a connection. And so all the more reason to make sure that you are diligent at home with your hygiene routine and, obviously doing everything else for proper health, good diet, and exercise. But hope you learned something new today. Hope this was informative for you. If you found this useful, pass it along, share it with your friends, and of course tune in next week to another episode of Tooth Teacher Tuesday. Have a great week, everyone.